Hello, dear. Hello, dear students. Hello, everyone. Please inform me that audio, video, everything is okay. Yes. Good evening, everybody. Yes, Hitesh, Kushal, Ram Beta, Taksha, Aditi, Sagar. Good evening, everybody. Yes, Nili. Can you inform me that audio, video, everything is okay? Everything is okay. So this is the English fast track revision class in form of the MCQ pattern. So here we are going to look for the 50 questions. Okay. So are you ready for this beautiful session? Okay, so let's start this session. So question number first, which major organ lies deep to the right hypochondric area? So can you tell me which organ? Yes, tell me. Tell me Daksha, Pooja, Aditi. Yes. Yes, well, already the English session already done. So this is the totally English session. Okay, I want to inform everybody. This is the totally English session. Okay, because English session already done. Okay. Yes, liver. Very good. Very good, Jyoti. Yes, answer is the liver. Again, with the beautiful three-dimensional orientation, you can see here all the facts. Yes, again, lal full, neela full, anatomy beautiful. Look here, we know very well that our abdomen is divided into the our yes different quadrants. Fine. So there are the total 9 quadrants. The two vertical lines which are passing through the midclavicular line, tip of the ninth costal cartilage, and the mid-inguinal point. Okay, sir. And two horizontal lines. Yes, the transpyloric plane, which is passing through the pylorus, and another is a transtubercular plane. Getting the point? Okay. So the right hypochondrium area, then epigastric area, then left hypochondrium area. Right lumbar, umbilical, left side our lumbar area, then right iliac fossa, and then here is the hypogastrium. Here is the hypogastrium, right iliac fossa, hypogastrium, and here is the our yes, you can say the left iliac fossa. Getting the point? So total 9 quadrants are there. Can you see in the right hypochondrium which organ is located? Answer is the liver. Done. Okay, getting the point? Okay, sir. So answer is the liver in this question, right? Now come to the next question. Which structures separates the thoracic cavity from the abdominal cavity? Now what is your answer? Now what is your answer? Yes, please inform me. Which structure separates the thoracic cavity from the abdominal cavity? Can you inform me? Which structure separates from the thoracic cavity and from the abdominal cavity? Yes, your answer is the diaphragm. Okay, your answer is the diaphragm. So diaphragm is the structure which separates the two cavities. Can you see this one? Sir, this is a diaphragm. So here is the thoracic cavity and this is the abdominal cavity. This is the diaphragm. Can you tell me how many diaphragms in our body? Very good. Very good, Smita. Yes, Buddhi Prakash, Sayyid. Total 8 diaphragms in the body. Okay, what is the diaphragm? Which separate the two cavity, which separates the two cavity. Okay, so what are the different 8 diaphragm of the body? Look here, suppose it is any our person, suppose it is any person na? Okay, so what are the diaphragm? In the brain there is a one structure which is separating the diaphragma, which is separating the our pituitary gland from the brain cavity. So that is the diaphragma celli. In the similar way, in eye, sir, in the eye, there is the iris. Iris separates the anterior chamber from the posterior chamber. So this is our iris. Okay. Now at the floor of the neck, this portion, this is our mylohyoid. Sir, this is the mylohyoid. It is separating the oral cavity from the neck. It is separating the oral cavity from the neck. Getting the point? So this is what? This is our mylohyoid. Next, in the neck, above the pleura, there is a membrane. Sir, this is the suprapleural membrane. It is also known as Sibson's fascia. It is also considered as the diaphragm. It is a diaphragm between the neck and the thorax. Agree, beta? Next, sir, here is thoraco-abdominal diaphragm, which is separating the our thorax and abdomen. So this is what? This is the thoraco-abdominal diaphragm. It is the fifth. Next, sir, there is our pelvic diaphragm. There is a pelvic diaphragm. This pelvic diaphragm is separating the abdominal cavity from the pelvic cavity. So this is the our, yes, you can say the sixth diaphragm. This is our pelvic diaphragm. And then there is our urogenital diaphragm. Yes, there is a urogenital diaphragm which is separating the our perineum area. Okay, which is separating the our, yes, superficial and deep perineal pouch. That is our, yes, urogenital diaphragm. And few authors also considered the femoral septa, which is separating the abdominal cavity from the femoral triangle. So this is also considered as the diaphragm. That is the our, yes, femoral septa. So these are the 8 diaphragms of the body. Interesting. Okay. If anyone is using only the word diaphragm, so remember it is our thoraco-abdominal diaphragm. If we say only the Kohli means Virat Kohli, Tendulkar means Sachin Tendulkar, Mangeshkar means Lata Mangeshkar, Bachchan means Amitabh Bachchan. In the similar way, if we are using only the term diaphragm, means it is the thoraco-abdominal diaphragm. Agree, everybody? Getting the point? Okay. Now look for the next question, number 3. Yes, look at this question. The marked nose in the given below image arises from which of the following plexus? So anyone? Use the common sense: cervical plexus, choroid plexus, lumbosacral, back brachial. So if you don't know answer, even then you can say, yes, sir, it is the our pelvic bone, sacrum bone. Yes, it is a lumbar area. Would you like to mark the cervical? Sir, cervical means neck. It is not the neck area. Excluded. Choroid plexus, sir, choroid plexus is related with the CSF. No, it is not the answer. Brachial plexus, no, it is related with the upper limb. It is related with the upper limb. Are you getting? Fine. So definitely it is not the our brachial plexus part. Yes, it is related with our lumbar area and the sacral area. So answer will be the lumbosacral area. Anyone? Can you give me the answer? What is the name of this nerve? What is the name of this nerve? What is the name of this nerve? This nerve is running in the posterior side, and then it is dividing into the one nerve and another nerve. Sir, this is nothing. This is our thickest nerve of the body. This is the sciatic nerve. MCQ, sir, it is the thickest nerve of body. The thickness is 2 centimeter. Are you getting? Sir, this nerve is very interesting because it is also considered as the pregnant nerve of body. What is a pregnant nerve? Yes, during the regular class I taught you, sir, there is any particular nerve which is very thick. Nerves are getting blood supply with the help of nervi vasorum, just like the vasa vasorum. But these nerves are very thick. So what is happening, sir? The artery nearby running artery, it is giving the branch which is running within the artery, which is running within the nerve. So here the nerve is acting like a mom, and the artery is acting like the baby fetus. So such kind of the nerves are known as the pregnant nerve. Yes, sciatic nerve is one kind of the pregnant nerve. Agree? Getting the point? Interesting. So can you tell me what are the other nerves which are considered as the pregnant? Means what are the other nerves which are having the, yes, artery within it? Yes, anyone? Try to give the answer. Sir, other pregnant nerves of the body. Don't forget the optic nerve. Within the optic nerve, the central retinal artery is running, and another is our median nerve. Within the median nerve, also there is one artery, that is the arteria nervi mediana. Within the sciatic nerve, there is the artery, that is a, yes, yes, you are right. Very good, Ram Swarup. But that is the our arteria nervi sciatici. Okay, so no need to go with that detail, but sciatic nerve is important. This sciatic nerve is dividing into the common peroneal nerve, and this is our tibial nerve. Are you getting? The common peroneal nerve further divides into the superficial peroneal nerve and deep peroneal nerve. So these are the our stories regarding to this topic. Agree? Yes, Shakti, good evening, beta. Is it okay? Can we move for the next? Okay, sir. So answer in this question is answer C. Come to the next. Yes, I think it is easy one. Look here. Sir, genetic material, the DNA is present in. Tell me. Yes, it is easy question. Chromatin? No. Nuclei? Never. Chromosome? No. Sir, deoxyribonucleic acid, it is located in nucleus. As we know, the primary structure of the cell. Sir, there is the our cell membrane. Right, sir? And here is the presence of cytoplasm. Correct, sir? And within the cytoplasm, you will be able to observe the nucleus, right? So we know very well the basic structure of the cell. Sir, this is cell membrane, this is cytoplasm, and here is the nucleus. We know very well that hereditary material, the DNA, is located, deoxyribonucleic acid is within the nucleus. Done? Easy? Okay, sir. Now come to the next. Yes, dear students, don't forget to follow me at Insta, YouTube, and such kind of different quiz at the Telegram. So I'm sharing this all the link for all of you. Yes, stay tuned with this one at my YouTube channel, at my Instagram. You can see the such kind of the many explanation, many free videos, as well as in the Telegram. You can join the our MCQs daily. Okay. Yes. So what I want to tell you, number of the chromosomes in the cell. Tell me better. Again, it is, I think, easy question. Number of the chromosomes in the cell. Can you tell me? Yes. The number of the chromosomes in a cell is 23 pairs, but it is only 23. So it is not 44. It is the number of the autosome. It is the number of the autosome. Okay. So it is not 46. Yes. 44 are our autosome plus sex chromosome XY in the male and XX in the female, right? And 40, no sir, it is not the answer. So answer is a C, 46. Yes, Aditi, right? Yes, Ram Swarup, very good, very nice. Done. Okay, so can you see the question? Another name for the cavity in the front or belly side. So this is a general anatomy question. It is a general anatomy question. Very good, Jyoti. Tell me another name for the cavity in the front or belly side. Is it dorsal? No, this is dorsal. Abdominopelvic, sir, abdomen and the pelvic, that is bottom area. No. Ventral, yes, this side is known as the ventral. Also, you can say, sir, it is anterior. Answer is C. Vertebral? No, sir, vertebra is on the back side. So this is not the answer. Am I right? Answer is C. Am I right? Answer is C. Agree? Fine. Right. Okay, Sakshi. Yes. Very good, Millie. Now come to the next. The arms lies on the side, on the fill in the blanks side of the trunk. So arms lie. medial, distal, lateral, posterior. Now you have to think that they are asking about the anatomical position. Yes, correct. Answer is C. So let's discuss about our anatomical position. Sir, in anatomical position, the eyes looking forward. Sir, hands hanging by the sides. Yes, and both fit together. Just simple diagrammatic presentation. And suppose these are the toes. So what is the anatomical position? One by one. First, body erect. Next, eyes forward. Next, yes, hands hanging by the side. Next, palm directed forward. Next, both fit together. And last, sir, toes forward. Is it okay? Fine. So this position is known as anatomical position. Agree? Agree, everybody? Right. So this is the answer. Now come to the next. Again, the question related with the anatomical position. Anatomical position could be described as which of the following? So can you tell me what is the answer in this question? Anatomical position could be described as which of the following? Lying down prone position? Just we had seen right now. No, sir, it is not the lying down position. It is the vertical position. Okay, so exclude this one. MCQ art, you have to exclude one by one. Lying down supine? No, sir, it is not the supine position. It is standing position. Standing, displaying ventral surface of the body. Yes, it is displaying the ventral surface of the body. It is right. Standing with arms and legs abducted. Arms are not abducted. Arms are adducted in position. Legs are adducted in position. So this is also wrong. So answer is C. Am I right? Yes, Jyotika. Yes, Jyoti. Everybody clear? Come to the next. Identify the lumbar vertebra in the following image. So can you tell me what is the name of this A, B, C, and D? I will show you the 3D orientation also. Yes, please answer. The A is also known as the cervical vertebra. Sir, B is also known as the thoracic vertebra. C is also known as the lumbar vertebra. D is our, yes, you can say the sacral vertebra, and this is our definitely the coccyx. Agree? Very good, Sakshi. Yes, Preeti. So this C is what? This C is lumbar. So according to this, answer is the our C. Perfect, Aditi. Very good. So can you tell me how many vertebra are found in adult and in children? Okay. So cervical, thoracic, lumbar, sacral, and the coccygeal. Remember, in the children, how many cervical vertebra? 7. How many thoracic vertebra? 12. How many lumbar vertebra? 5. How many sacral vertebra? 5. Now, how many coccygeal? Sir, 4. So, if you will see total 7 plus 12, 19, 5 plus 5, 10, and this is the 4. Okay. So, if you will add total, sir, these are our 33 vertebrae. So, in the children, how many vertebrae are present? Answer is the 33. But we know as the baby is growing, the vertebrae they are getting fused. So this sacral vertebrae it is becoming single, and the coccygeal it is also becoming single. So in the adult, don't forget it is very important formula in the adult. C7, T12, L5, but sacrum is getting fused 1 and coccygeal is also getting fused 1. So how many vertebrae in the adult? 7 plus 12, 19. Okay. 19 plus 5, 24, 25, and then 26. So total in adult you will see the 26. So remember 26 by 33 is equal to adult vertebrae upon child vertebrae. Very important. Very good. Very good, Aditi. Now, can you tell me about the spinal nerves? Yes, they are same in the adult and child. Na? So, spinal nerves. Sir, cervical, thoracic, lumbar, sacral, coccygeal. Okay. So, just see cervical vertebra, spinal nerve. Spinal nerve. We are talking about spinal nerve. Cervical spinal nerve 8, thoracic nerves they are 12, lumbar nerves they are 5. Okay. Sacral nerves they are also 5. Fine. And coccygeal nerve that is 1. So total remember 31 pairs of what? Spinal nerves. Don't forget. One question sure from this slide. Na? It is very favorite question of the NORCET exam. Yes. MCQ, MCQ, MCQ. Done. Can we move for the next? Fine. This is all about our vertebrae. Okay. Again, come to the next question. The major cation in extracellular fluid is. Now, what is your answer? What is your answer? Yes, please tell me. Yes, look here. If this is the cell, here is a nucleus. So this is the extracellular fluid outside the cell, and here is the intracellular fluid. Okay, sir. As we know, outside there is the more and more plus, and inside there is the minus charge is more predominant. Yes, in our Mendeleev table, sir, sodium is outside. Yes, it is more positive, and potassium is less positive. So remember, extracellular fluid, major cation is the sodium, and intercellular fluid, the major cation is our potassium. Fine. So answer in this question is sodium. Agree? Yes, Jyoti, Pooja, you all are right. Fine. Here is one table for all of you. Sir, outside sodium chloride is more. So remember, the salt NaCl is more on the outside, while inside you can see, sir, potassium and phosphate. So inside the phosphate is more. Are you getting? So outside the cell, the NaCl is more, sodium is more, and chloride is more. And inside the potassium phosphate is more. So major cation in our intracellular fluid is potassium, and the major anion in intracellular fluid is phosphate. Agree? Come to the next question. Yes, this question. In an average adult male, 70 kg weight, approximately what percentage of the total body weight is composed of water? So now what is your answer? What is your answer? Yes. 60%. Fine, 60% is right, but here in the option 70% is given. So according to it, you will go for the 70s. You can say 60 to 70%. Fine. Remember, the 70% of our body is our water. Water is very, very important. Yes. 50 to 60%, 60 to 70%, 60. Few authors are saying 60%, few authors are saying 70%. Fine. Here the in option 70% is given. So answer is the 70%. Now come to the next. Adrenaline is also known as. So I think it is easy question. Na? Adrenaline is also known as. Yes. Answer is the our epinephrine. Remember, noradrenaline is also known as the norepinephrine. Epinephrine is also known as the adrenaline. Okay. What is the difference between this? There is a little complicated structure. Just to remember, there is a one benzene ring. Na? Okay. Fine. Suppose this is noradrenaline. There is the any kind of functional group. We don't know the exact structure and no need to remember the exact structure. But if one methyl group is added, one methyl group is added. Okay. So this methylated group is known as adrenaline or epinephrine. So what is the difference between the noradrenaline and adrenaline structure? Just remember one methyl group. One methyl group is the difference. Agree? Got the point? Come to the next. Glucocorticoid is secreted by which layer of the adrenal gland? Now, what is your answer? Yes, physiology question. What is your answer? Yes. Do you know, sir? The adrenal gland is divided into the two parts, cortex and medulla. Sir, medulla is releasing the adrenaline and noradrenaline, but the cortex is divided into the three area. You can remember the mnemonic GFR: zona glomerulosa, zona fasciculata, zona reticularis. Are you getting? So these are the three zones. Remember, zona glomerulosa, fasciculata, reticularis. Zona glomerulosa, it is secreting the mineralocorticoid. Fasciculata is secreting the gluco. Yes, glucocorticoid. Reticularis is secreting the sex hormones. Yes. MCQ, 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 MCQ. Agree, everybody? These are the different MCQs. Is it okay? So here, glucocorticoid, they are asking about the glucocorticoid, which is secreted by the fasciculata. So answer is the B. Answer is the B. Agree, everybody? Moving for the next question. Look, yes, again, physiology question. You can see which of the following is the correct definition of the positive feedback. You know, in our body, the maximum cycles are negative feedback. Okay. Yes. Okay, Jyoti. Thank you. You are teaching very well, sir. I have come for the first time on the Chennai. Thank you, better. Thank you. God bless you. Okay. Yes, you will find the many useful content at this channel. Also at my personal channel, Dr. Shrikant Verma classes, YouTube, Telegram, and Insta. So don't forget to follow me at this different channels better. And also any kind of a doubt, you can ask there. Okay, so I'm putting this channel again for all of you. So can you tell me what is the answer? What is the answer? Yes, yes, yes. Please try, dear students. So catch this one. Yes, catch this one. The maximum cycles in our body, they are positive feedback. Look here, positive feedback. Yes, maximum cycle, they are negative feedback, na? Negative feedback means there is the our like just example of the our hypothalamus. It is stimulating the pituitary gland, and then the pituitary gland is releasing the hormone which is acting over the any particular gland, and then there is a secretion. But due to the negative feedback mechanism, this secretion will inhibit the pituitary gland as well as the hypothalamus. So this is known as the negative feedback cycle. Maximum cycles are negative feedback, but there are the few positive feedback cycles also, which are also known as the, yes, vicious cycle. These are also known as the vicious cycle. Getting the point better? Okay, vicious cycle. Fine. So what is happening? There is the certain kind of the stimulation which is causing the secretion, and now this secretion is again stimulating. Okay, so this is the positive or vicious cycle. The two classical example, every cycle in our body is negative feedback, but the two classical cycle which are vicious. Okay, fine. Now look here. Yes, first remember the example of the vicious cycle, that is the milk ejection reflex. Baby is sucking the milk. Okay, fine. Baby is sucking the milk, which is stimulating the more and more secretion of the milk. So this is the due to the effect of the oxytocin. This is a milk ejection reflex. Another one is our delivery, parturition. So during the delivery, yes, once the event of the parturition, once the event of the baby delivery started, so again oxytocin will start to more and more contact the uterus. Okay, so these two cycles are classical example of the vicious cycle, positive feedback. Agree? Okay, so what is the answer? The process by which the body maintains the homeostasis? No, homeostasis is maintained by the negative feedback cycle. Next, a mechanism in which the body responds to stimulus opposes the stimulus? No, but it stimulates the stimulus. A mechanism where the body responds to the stimulus by acting, enhancing the stimulus. Yes, enhancing. It is right. The dynamic equilibrium maintained by an integrating center, which causes an effector to respond to the stimulus received by the receptor. So it is not the dynamic equilibrium. No? Yes, it is enhancing mechanism. So again, this is not the answer. Answer is C. Agree? Yes, Jyoti, you are right, but C. C is the answer. Now, come to the next. Come to the next. Match the following glands according to their manner of secretion. So this is the one bouncer kind of the question. What is the correct matching? Anyone? Tell me what is the correct answer. Merocrine gland, apocrine gland, holocrine gland. First of all, I'm going to tell you what are this. Look here. Sir, this is the method of the secretion. Suppose it is any gland which is doing secretion. Okay, it is synthesizing and it has to secrete. So how it can do secretion? Look here. Three method. First, this cell is just doing the exocytosis. It is just releasing, no destruction. So these are the good gland. These are the merocrine gland. Also, you can say these are the ecrine gland. Is it clear? Sometimes what is happening? The cell apical portion has been destroyed. Are you getting? Yes, apical portion has been destroyed. Now secretion is coming out. So this is known as apocrine gland. Yes. Are you getting the nomenclature? Apo means apical. Apo word is indicating the apical. Now sometimes what happens, the entire gland is getting rupture. Entire gland is getting rupture, and it is releasing its secretion. Whole gland getting burst. So this is the hollow crime. Are you getting? Whole hollow. Apical portion bursting, apocrine. No bursting, no destruction, that is the merocrine. Agree? Agree everybody? Fine. So this is the thing which you have to remember. It is the our what? It is the holocrine gland. Now the example. Remember, the holocrine gland is our sebaceous gland. Sebaceous gland is a classical example of the holocrine. Okay? Yes. Apocrine. So remember the gland, modified sweat gland. They are apocrine. And yes, the sweat gland of palm and sole. These are the classical example which you have to remember. Na? The sweat gland of the palm and sole, they are good gland. They are just releasing the secretion. They are just releasing the secretion. Okay, fine. While the modified sweat gland, which are having the peculiar smell, which glands are having the peculiar smell? Pheromone activity, sir. Axillary sweat gland. You can remember A for axillary, A for apical, A for axillary, A for apical. So there is a peculiar smell in the axillary sweat gland, sir. Perineal sweat gland. So this peculiar smell in the perineal sweat gland. Okay. Also the ceruminous gland in the ear. These are the classical examples of the modified gland. And yes, sebaceous gland. Don't forget this sebaceous gland, which is the classical example of the sebaceous gland. Remember the sebum gland. This yes, holocrine. The oily skin. We are having the oily skin due to the sebaceous gland. They are classical example of the holocrine. Don't forget it. Also, the pancreas. The pancreas, they are good gland. Fine. So according to it, sir, merocrine gland, answer is the pancreas. Apocrine gland, the mammary, the breast gland is the mammary, and the holocrine sebaceous. But look over the option now. 1B, 2C, and 3A. So it is not the A, B, C. So they can put any kind of the option. Na? Proper, you have to make the alert for each and every question. So it is 1B, 1B, 1B. 2C. Yes, 2C. No, it is not. 3A. 3A. So according to it, answer is the A. Are you getting? Answer is the A. So remember, look how they are giving the number also. Fine. So just one twist in this question. Agree, sir. Now come to the next. What hormone does the adrenal medulla produce? Yes, we had seen. We had seen this question. Na? Adrenal medulla, it produces the our yes epinephrine and norepinephrine. Yes, we had seen already this question pattern. Again, adrenal medulla, cortex and the medulla, adrenal gland. Medulla is producing the adrenaline or adrenaline. This was the question. And cortex, zona glomerulosa, zona fasciculata, zona reticularis. Glomerulosa, mineralocorticoid. Fasciculata, glucocorticoid. Reticularis, sex hormones. Agree? Fine? Right. Now, look for the next. Phase 2 of action potential depicted in the figure is due to what? So this is a phase 2. So can you tell me what is your answer? Comment at the comment box. Yes. Perfect. Yes, Ram Swarup, you are right. Answer is the our calcium influx. Okay. So I'm going to tell you about these refluxes. Okay. Look here, sir. This is our axis. Which axis? X axis. Suppose horizontal is the X, vertical is the Y. Okay. So there is a resting membrane potential. Okay. Resting membrane potential. Sir, suppose it is our minus 90 millivolt. Yes. The NOS, they are having the minus 70 millivolt. So you will see there is a no change in the current and there is a stimulus is given. One quick summary. So this is the stimulus artifact. Then there is a no response. This is the latent period. Now there is a slow sodium influx. There is a sodium influx. So sodium ions are coming inside the cell. Are you getting? So can you tell me when the sodium is coming inside, then the curve will go up or down? The curve will go towards the positive side. So this curve is rising. So this is a slow sodium channel. Now, as the sodium is getting influx, it will say, it will tell to the other sodium to come fast. Yes, my friend, I reached inside. Come fastly. So now there is the fast sodium channels are getting open. So this curve will rise very sharply. So it is getting rise very high. Fast sodium channel. Are you getting? Okay. Now, suppose this is 0 millivolt. It is 0 millivolt. So still the sodium ions are coming inside. So this curve is rising up. But then there is the one limit. Now the sodium ions are getting closed. Agree? Fine. So here the sodium channels, they are getting closed. So another, the potassium channel is getting open. So what is happening? Potassium ions are going outside. So this curve is coming down, 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 down. Okay. Yes, potassium is showing efflux. But at the same time, in the heart, if you will talk about the heart, yes, calcium ion is coming in. So positive are going out, positive are coming in. So any change in the voltage? No, no change in the voltage. So this voltage is getting flat. So this is the plateau phase. This plateau phase is due to which ion? Answer is the calcium. Now here the calcium ion open, and now at this point the calcium ions are getting close. Calcium channel is getting close, but the potassium is still going out. The potassium is still going out. So now what is happening? The curve is coming down and excessive potassium is coming down. That's why there is the hyperpolarization down to the minus 90 millivolt. And then again, yes, it is balancing with the sodium potassium ATP. So it is coming at the normal position. Are you getting? Complete. So this is our zero phase. Then you can say the phase 1, phase 2, phase 3, phase 4. Okay. Yes, you can say Ram Swarup, you're right. So you can see the zero phase 1, phase 2, phase 3, phase 4. Done. So this phase 2 is due to the calcium influx, right? Okay, now come to the next question. Transitional epithelium is present in all of the following except transitional epithelium. For your help, I'm saying this is also known as, this transitional epithelium is also known as urothelium, and it is having the urinary bladder. It is having the urine. Yes, it is having the stretching property. Now it is having the umbrella cells, better to say. It is having the umbrella cells. Now what is your answer? Male urethra, ureter, urine bladder, and rectal junction. So remember, it is present in the our urinary tract. Male urethra, yes, it is urinary tract. Sorry, urinary ureter, it is also the urinary tract. The urine bladder, it is also the our urinary system. So all are the part of the our urinary system. And in the urinary system, you'll see the umbrella cells, urothelium, transitional epithelium. But this anorectal junction, no. The anus and the rectum, remember, at this anorectal junction you will see the squamo columnar junction. Okay, fine. So definitely here answer is the D. Answer is the D. Very good. Nursing fan. Yes, Sakshi, Aditi, Jyoti, Ramsarup. You all are right. Come to the next. Bone forming cells are known as. Now, what is your answer? Bone forming cells are known as. What is your answer? Osteocyte. Sir, these are mature bone cells. No. Yes, osteoblast. They are blast. These are immature cells. And they will form other cells. Yes. So definitely it is the answer. Osteoclast, they are bone destroying cells. These are bone destroying cells. And monocyte, sir, these are the blood cells. So definitely it is not the answer. It is not the answer. It is not the answer. Answer is the B. Agree? Yes. B. B is your answer. Now come to the next question. The patient with type 1 diabetes mellitus is in the clinic to check his long-term glycemic control. Which test should be used? Yes, they are saying the long term. They are saying the long term. Water deprivation test? No, sir. Fasting blood glucose test? It is the immediate test. So don't go for this, our fasting blood glucose. Oral glucose tolerance test? No. It is also occurs our immediate. Yes. Glycosylated hemoglobin? Yes. This HbA1c. This test is measuring for the our 90 days, more than 90 days blood glucose level. Na? So best answer is the HbA1c. Yes, Aditi, right. Any doubt with this question? Can you move? Right. Come to the next. Thyroid follicles are lined by. Yes, 90 days. Sakshi, you are right. 90 days. Thyroid follicles are lined by. What is your answer? Thyroid follicles, they are responsible for the synthesis and secretion. Okay. Sir, columnar epithelium, these cells are having the longitudinal nucleus and they are synthesizing and storing. But the thyroid follicle, they are synthesizing and secreting. So it is not the answer. Sir, transitional epithelium, these are having the umbrella like appearance. So when you are adding the stick, it is just looking like the umbrella. Are you getting? So transitional epithelium, it is found in the our urinary tract. Again, it is not the answer. Cuboidal epithelium, yes, all the dimensions are equal. So they are synthesizing and they are releasing. Yes, it is the answer. Squamous epithelium, the basement membrane, the cells are flat and the nucleus is also parallel to the basement membrane. These are flat cells, so they are responsible for the exchange. Answer in this question is our, yes, you can say the cuboidal epithelium. Is it okay? Done? Right, sir. Now look for the next. Gallbladder is lined by. Gallbladder is lined by. Yes, Adya, good evening, better. Gallbladder is lined by. Now, what is your answer? Yes, the gallbladder again, it is responsible for synthesis and storage. Okay, so simple squamous epithelium, they are just flat. These are responsible for the exchange, like the air exchange, like the blood exchange, nutrition exchange. So simple cuboidal, these are cube shaped. So they are synthesizing and they are secreting. That is cuboidal epithelium. Sir, simple columnar, they are synthesizing and they are storing. Yes, in the gallbladder, the same phenomena is there. So answer is the C. Yes, simple columnar ciliated. So there is our column epithelium. They are storing. but there is also presence of the cilia. Okay. Yes, when you have to show the motility, then there is a simple columnar epithelium. Here, no need of the motility. So answer is the C. Yes, Priya, Sudhir, right, Ram Swarup. Very good. Answer is C. Come to the next. Which hormone is produced by parafollicular cells of the thyroid gland? Thyroid gland is important. Look here. When you will see the thyroid gland, you will see the follicle. Sir, the cube-shaped cells, cube-shaped cells, cuboidal cells are located. Nucleus are also present here. They are synthesizing and secreting within the lumen. So this is the T3 T4 hormone. Yes. So these are the follicles. These are the follicles. These are the follicles. Are you getting? But there are the certain cells which are outside the follicle. There are certain cells which are outside the follicles. These are known as parafollicular cells. These are known as parafollicular cells. Are you getting? Yes. These are also known as the C cells of the thyroid. These are also known as the C cells of the thyroid gland. Okay. These are responsible. Are you getting the name? Sir, C for calcitonin. So these are secreting the calcitonin hormone. These are secreting the calcitonin. Answer is the calcitonin. Done? Okay. Okay, Sakshi. Now come to the next. Exocytosis. You know exocytosis, endocytosis, pinocytosis. Sir, there is the certain cell. They are synthesizing and just they are releasing. Extrusion. Intrusion. Sir, this is our endocytosis. Okay. Getting the point? Fine. Yes, solid particle intrusion, like you can say this is the phagocytosis. Okay. Uh, Fine. So not all of the would definitely this is not answer is the A. Done. Okay, sir. The thyroid gland. What is true about the thyroid gland? Thyroid gland, it is located below the larynx. It produces antidiuretic hormone. No, sir. The antidiuretic hormone, the ADH, is produced by posterior pituitary. Secretes a small amount of the insulin. No, sir. This insulin is secreted by the beta islet cells, helps initiate milk production. Never. The milk production is under the control of the prolactin hormone. Yes, it is located below the larynx. Here is the larynx. It is located below the larynx. The isthmus of the thyroid gland is located just opposite to the second and fourth tracheal rings. Answer is A. Is it okay? No doubt. Come to the next. Patient with diabetes mellitus who neglect insulin therapy rapidly metabolize the lipids, and there may be an accumulation of acidic byproducts of the lipid metabolism in the blood. What effect would this have on respiration? Yes, you can say Ram Swarup. You're very right. Yes, yes. So look here. This is the condition of the diabetes mellitus. In the diabetes mellitus, yes, due to the deficiency of the insulin, there is a ketoacidosis. Fine. So there is the our accumulation of the acidic byproduct, and this will result to wash out the carbon dioxide. So to increase the washing of the carbon dioxide, definitely we have to increase in the respiratory rate. We have to increase in the respiratory, which is also known as the osmoles. Breathing, are you getting? Decrease in the respiratory rate? No. Decrease the respiratory if oxygen is reduced? No. No influence on the respiratory rate? No. Okay. So in case of the diabetes mellitus, sir, there is the our polyphagia, polydipsia, yes, polyuria, plus ketonemia, ketonuria, ketoacidosis. So you will see the PK, 3P and 3K. These are found in case of the diabetes mellitus. 3P, polyphagia, polydipsia, polyuria, 3K, ketonemia, ketonuria, and ketoacidosis. Are you getting? Okay. So to maintain this ketoacidosis, there is the increase in the respiratory rate, and whenever there is an increase in the respiratory rate, yes, carbon dioxide is washed out. Carbon dioxide is washed out. Done? Okay, sir. Now come to this. Decreased arterial oxygen content is seen in. Decreased oxygen content is arterial. Decreased arterial oxygen content is seen in what? Fine. Tell me, sir, there is a decrease in the stagnant hypoxia. Sir, there is a stagnation. Means this is the blood supply and this is blockage. So decreased oxygen is there. So that is a stagnant. Anemic hypoxia, yes, due to the decrease RBC or decrease hemoglobin or due to both decrease, there is a anemia. Then there is a decrease arterial oxygen content. So answer will be the B. Histotoxic due to the any poison, and ischemic due to again, yes, decrease blood perfusion. So answer is the B. Anemic hypoxia, yes, Ram Swarup, yes, Sagupta Khan, you are right, better. Come to the next. Hypoxia due to showing of the circulation, due to the slowing of the circulation. Now what? Yes, the slowness of the blood circulation. Anemic, no, it is due to decrease RBC, decrease hemoglobin. Histotoxic due to the any poison like the cyanide. Stagnant, yes, due to the slowing of the circulation. No, not the none. Answer is C. Am I right? Any doubt? Done? Okay. Now, during exercise, increase in oxygen delivery to the muscle is because of all except. Now, what is your answer? When we are doing the exercise, okay, more oxygen is delivered to the muscle because muscles are demanding for the more blood supply. Okay, because of all except. What is your answer? Oxygen dissociation curve shifts to the left. Remember the oxygen hemoglobin dissociation curve, whenever the curve is shifting to the right, more release. Okay, so this exactly matching. Increase stroke volume, yes, yes, because of all except. Fine, it is right, but it is saying left. It is saying left. Yes, it is wrong statement. They are saying except. Increase stroke volume. So whenever we are doing the exercise, there is a more pumping activity of the heart, so stroke volume is increase. Yes, it is true, this false. Increase extraction of the oxygen from the blood, definitely. There is the easily release of the oxygen from the blood, so it is also right statement. Increase blood flow to the muscle, definitely during the exercise more blood supply. So which is wrong? It is not the left, but it will shift to the right. The oxygen hemoglobin dissociation curve. So answer in this question is A. A. Okay. Come to the next. Deficiency of thyroxine in adults leads to a condition called. Tell me. Tetany. Yes. Tetany occurs due to the hypocalcemia. So it is not the answer. Cretinism. Sir, it is due to the decreased T3, T4. But in child, remember, C for cretinism, C for child. Mixed edema, yes, decrease T3, T4 in adults. Graves' disease, sir, it is increase in T3, T4. So answer in this question is C. C. Yes, Ankush, Sakshi, Sangupta. Yes, move on. C is the answer. Okay. Graves' disease is the hyperthyroidism, not deficiency, but increase in the thyroxine. Yes, Ashna, right. Come to the next. Melatonin is secreted from which of the following marked area? So you have to tell me about the melatonin secretion. Yes, look here. This A is just behind the our midbrain part. Sir, this is nothing. This is the pineal gland. Sir, this B is indicating the pituitary gland. Sir, this is about our thyroid cartilage. Okay, fine. So there will be the our thyroid gland location. Sir, this C is indicating our thymus. Sir, this D is indicating our about the adrenal gland, and this is definitely our pancreas. So here the pineal gland is secreting the melatonin. Remember, this melatonin is responsible for the secretion of, yes, this melatonin is responsible for the circadian rhythm, the biological clock activity. Agree? Fine. So this melatonin is controlling the visceral activity. Yes, the Lord Shiva is having the capacity to control the visceral activity. Are you getting? So this pineal gland is also considered as a third eye of the Lord Shiva. Yes, it is also considered as a third eye of Lord Shiva, which is secreting the our melatonin hormone. Agree? So answer in this question is A. A. Very good, Sakshi, Aditi, you all are right. Ankush, perfect. Sakshi, Ramsarup, Sagupta, you all are right. Third eye of the Lord Shiva. Okay. Now can you tell me the answer? 32. Again, it is easy question. Gas exchange takes place in the larynx. No, sir. It is sound box. It is not the answer. Bronchiole. No, sir. It is just part of the respiratory tree. It is conducting the air. No. Alveoli. Yes. Pleura. Sir, it is covering of lung. It is not the answer. Alveoli. I think it is easy question. Yes. Aditi, Priya, Ankush, Ramsaru. Okay. Okay. Now come to the next. In what form is the majority of the carbon dioxide, CO2, that is generated by the cellular respiration transported to the lung? So just tell me how the carbon dioxide is transported into the our transported to the lung from blood to the lung. Yes, yes, Ankush, you are right. As dissolved carbon dioxide in the blood plasma? No, very less percent. I think 7%. Bound to the hemoglobin in red blood cell? No, sir. Very less amount is found. As carbonic acid inside the red blood cell, and as bicarbonate. Remember, sir, H2O plus CO2 in presence of the carbonic anhydrous, it is making the H2CO3. Right, sir. But then again in presence of the carbonic anhydrous, it is changing into the H plus and HCO3 minus. This bicarbonate is the major form which is transported. So answer in this question is as bicarbonate ions in the blood plasma. Okay, done. Agree? Okay, sir. Now come to this question number 34. Which is the incorrect statement among the four below? Now, what is your answer? More oxygen is carried bound to hemoglobin than dissolved in the plasma, which is incorrect. We have to look for the incorrect. We have to look for the incorrect. More carbon dioxide is carried bound to hemoglobin than dissolved in the plasma. Okay, more carbon dioxide is carried bound to hemoglobin than dissolved plasma. No, incorrect statement. Okay, this is right. Yes, the more carbon dioxide is carried bound to hemoglobin than dissolved in plasma, right? Hemoglobin buffers hydrogen ions derived from the carbon dioxide. Okay, and carbonic anhydrase is the enzyme that binds oxygen to the hemoglobin. Yes, this carbonic anhydrase, it is binding the oxygen to the hemoglobin. This is false statement. This buffer is also right. Sir, again, carbonic anhydrase, it is what it is doing. Sir, it is doing the H2O plus CO2 and making the H2CO3. And again, same, it is making the H plus and HCO3 minus. So this is the activity. So they are asking about the incorrect statement. So carbonic anhydrase is not the enzyme which is binding the our oxygen and hemoglobin. It is incorrect. Are you getting? Fine. Incorrect statement. Incorrect statement. Okay. Right. Now come to the next. 35. Where does the actual gas exchange between inspired air and the blood in the capillaries occurs? Yes. Now what is your answer? Okay. Look here. They are asking about the gas exchange. No? So this is the our alveoli. Here is a blood vessel. Oxygen is coming. So now oxygen is transported to the blood and the carbon dioxide is transported from blood to the alveoli. Okay. So what is your answer? Neither the bronchi nor the bronchioles. Respiratory bronchioles also not the correct answer. The best answer is alveolar duct and the alveoli. Alveoli is the best. Okay. So the respiratory unit, it starts from the respiratory bronchiole, but the best answer is the alveoli. So here the best answer you will opt the C. Come to the next. Yes. What happens when carbon dioxide levels in the blood decrease to the below normal? Yes, tell me. What is your answer? Yes, carbon dioxide levels in the blood decreases to below normal. Sir, pH of the blood decreases, carbon dioxide is decreased below the normal. So carbon dioxide, oxygen is alkaline and carbon dioxide, yes, it is producing the acid. Fine. So when the carbon dioxide level is falling, then blood pH will increase. So it is wrong. The blood becomes more acidic. No, the blood becomes more alkaline. The concentration of the hydrogen ion in the blood decreases. Yes, pH does not change. No, pH will change. Again, sir, CO2 plus H2O. It will make the H2CO3 and then it is making the H plus HCO3 minus. So when the level of the carbon dioxide is increased, sir, the H plus is increased. So opposite, when the carbon dioxide is decrease, so H plus will decrease. So yes, this statement is normal. This is right. Is it okay? Clear, Ankush? Right? Okay. Question number 37. Which of the following buffer systems of the body is affected by the action of the lungs? Yes, affected by the actions of the lungs. They are asking about the buffer system. Okay. So which is the buffer system? Sir, again carbonic acid and the bicarbonate. In the lung, protein, no sir. Mono hydrogen phosphate dihydrogen, no sir. Ammonia, ammonium, no sir. So remember, in the lungs, again there is a H2CO3. Yes, the carbonic acid, the carbon. So answer is the D. I think there is no confusion. Okay, same thing for the three times. Yes, learn, kid. Now, can you see the carbon dioxide is carried from body tissue in what form? The carbon dioxide is carried from body tissue in what form? Okay, dissolved carbon dioxide? No. Oxyhemoglobin? Never. It is saying about the oxygen, but question is about the carbon dioxide. Carb amino hemoglobin. It is carbon dioxide plus amino, the plasma protein. Bicarbonate ion, yes. HCO3 minus. Again, the same question. You can say the H2O plus CO2. Yes, it is making the H2CO3, then H plus and HCO3 minus. And definitely the enzyme name is the carbonic anhydrase, which is the fastest enzyme of the body, which is having the zinc. So answer in this question is the D. D, 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 D is the best answer. Yes, Sakshi. Total lung capacity. So tell me, what is the total lung capacity in a healthy adult male? Total lung capacity, you can say the TLC. 500 ml, no. Yes, total lung capacity. So inspiratory or expiratory volume, this all okay in 1 minute. Answer is a C. Yes, it is the, you can say 5 liter to 6 liter. 6 liter is the best answer. C. It is approximately the amount of the blood. Okay. Yes. Now tell me, process that occurs in the absence of the oxygen. Anaerobic and aerobic means oxygen absent. Internal respiration? No, sir. This is occurring within the cell. Yes, there is the exchange between the blood and the our cell. It is not the answer. Cellular respiration? Sir, within the cell there is a respiratory activity, ETC cycle. So it is also not the answer. External respiration? Yes, there is an exchange of the gas between the blood and the lung. So it is also not the answer. Answer is A. Answer is A. Okay, yes. Which of the following formed elements of the blood is important in the formation of the clot? So again, it is easy question. RBC? No, sir. It is carrying the oxygen. Carbon dioxide? It is not the answer. Lymphocyte? Sir, it is participating in immunity. It is also not the answer. Monocyte? Sir, these are the phagocytic cells. Thrombocytes? These are responsible for the clot. Okay? These are responsible for the clot. Fine? Okay, sir. Now, look here. Muscle relaxants are used routinely during anesthesia with resultant closure of the vocal fold. Laryngeal intubation by anesthesiologist is necessary. Which one of the following muscle is unable to keep the glottis open? So can you tell me which muscle is abductor of vocal cord, which is also known as safety muscle of larynx? Very good, Ankush, learn kid. Yes, Sagupta, Muva, Mili. You all are right. This is our posterior cricoarytenoid. This posterior cricoarytenoid, it is contracting. It is arising from the posterior side, from cricoid to the arytenoid. Suppose this is the our arytenoid. So there is the our, yes, you can see this is muscular process. This is the vocal process. So muscle is coming from the posterior side. From cricoid, it is taking origin, and arytenoid, it is getting insertion. So cricoarytenoid. So when it is contracting, it is causing movement away, both sides. So they are causing movement away. So due to this, the vocal cord is abducting. The vocal cord is abducting. So oxygen is going inside, carbon dioxide is coming outside. So this all are due to the posterior cricoarytenoid. And when oxygen, carbon dioxide is going inside, outside, the person can survive, can breathe. If these muscles are paralyzed, the vocal cord, it is getting adducted. Vocal cord is getting adducted. So now the person cannot breathe. Difficulty in, yes, oxygen carbon dioxide exchange. So the person can get death if there is the paralysis of this posterior cricoarytenoid muscle. So that's why these muscles are known as a safety muscle of the larynx. These muscles are known as the safety muscle of the larynx. Done. Now, pulmonary surfactant is secreted by. Tell me the answer. Pulmonary surfactant secreted by what? Type 1 pneumocyte, these are 95%. They are responsible for the exchange. Type 2, these are only 5%. They are causing the DPPC release, dipalmityl phosphatidylcholine, which is the surfactant. So answer is B. Sir, Clara cells, they are phagocytic cells, and bronchial epithelial, they are just lining epithelium. Answer is the B. Done. Next, paranasal sinuses present at the birth. Remember, because it is present at the birth, so these will grow most. So these are the largest paranasal air sinus. Yes, these are nothing. These are the maxillary air sinus. Yes, maxillary air sinus. Okay. Yes, Ankush, you are right. Maxillary air sinus. Next, which of the following is not a part of the gastrointestinal tract? Which is which of the following is not a part of the GIT? Ileum, yes, it is a tract. Pancreas, no, sir, it is a gland. Rectum, yes, it is a tract. Cecum, it is also the part of the tract. But a pancreas is not the part of the GIT. It is a gland. I think easy. Come to the next. Which statement about the layers of the alimentary canal is correct? Yes. Which is the correct statement? The serosa absorbs the products of the digestion? No, sir. Serosa is just one layer of the collagen which is protecting the GIT. That is not responsible for the absorption. Mucosa protects against self-digestion. Yes, you can say there is a layer of the mucosa, okay, which is preventing the digestion of the GIT from the GIT secretion. Yes, it is right. Submucosa is involved in segment and peristalsis. No, sir. Peristalsis is shown by the muscles, and muscles are found in the muscular layer. So it is also the wrong statement. The muscularis externa is dense connective tissue. No, the connective tissue layer is the our serosa. So this again false. So how to choose the correct answer we are looking in this session. Agree everybody? Answer is the B. Correct. Aditi, Ram Swarup, Pooja, Ankush, you all are right. 47. What is the gastroesophageal sphincter? Where is the gastroesophageal sphincter? Gastro, as the name is suggesting, gastroesophageal. Sir, this is esophagus. Here is the stomach, and this is the duodenum. So this is gastro, and this is esophageal. So here is a gastroesophageal sphincter. Between the stomach and duodenum, no. Between the stomach and duodenum, you will see there is our pyloric sphincter. Between the stomach and the cecum, no, sir. How you can opt this answer? No connection between the stomach and the cecum. So this option is crying and saying, I am not the answer. Don't mark me. At the entrance of the stomach, yes, this is the entrance site of the stomach. So this C is the answer. Before the external anal sphincter, never. No relation of the anal canal with the stomach and the esophagus structurally. So this is the one common sense question. So whenever you are looking the options, be cool, calm, relax. Yes, exclude the option one by one and opt the best answer. Yes, perfect. Ankush, we we locked the C option. You are right. Next, what are the end products of the carbohydrate digestion? Again, can you tell me what are the end products of the carbohydrate digestion? Yes, chylomicron. Never, sir. Amino acid. It is the end product of the protein. Sir, chylomicrons. These are the end product of the fat. Yes, free fatty acid. Again, the chylomicron. They are making our fat part. Okay, so again you can say this is our fat. Monosaccharide. Yes, carbohydrate is breaking down into our monosaccharide. The answer is the D. Answer is the D. Okay, clear? Yes. Very good. Learn kid. Mili, Mahesh, Ankush, Sagupta Khan, Pooja. Very good. Now, can you see the question number 49? What are some products of the lipid digestion? What is some products of the lipid digestion? Free base in the pentose sugar? No, sir. Pentose sugar, it will be derived from the nucleic acid digestion. Fructose and glucose? No. It is related with the our carbohydrate metabolism. Amino acid and small peptide? Never. It is related with the protein digestion. Free fatty acid and the monoglycerol? Yes. This is the answer. So remember, sir, there is the our lipid in presence of the enzyme lipase. It is changing into the free fatty acid plus you can say the glycerol. The lipid digestion is producing the free fatty acid and the glycerol. Done. D. Yes, Nili, Sagupta, Mili, Mova, Tanvi, Pooja, Larkid, you all are right. Perfect, Ankush. Come to the last question. Which of the following is an active enzyme? Pro carboxypeptidase. It is already saying, yes, it will convert into the carboxypeptidase. Pro means precursor. Pepsin, yes, sir. The pepsinogen in presence of the HCl, it is converted into the pepsin. Telophase, sir, it is related with our, yes, meiosis. So how you can say the telophase is here? Trypsinogen, sir, it will convert into the trypsin, which is the active form. So definitely answer is the B. Pepsin, yes, Aditi, Mahesh, Ankush, Ram Swarup, Learn Kid, you all are right. Yes, Mova, very good answer. Now, one bonus question. We targeted for the 50 question. Yes, this is the bonus question. What is the term applied to the production of the glucose from non-carbohydrate molecules? Okay. So, glucose production from the non-carbohydrate molecule. This is not sir. Deamination. Deamination means removal of the amine. No sir. Amino group, no, not transamination means transfer of the amino group, no. Glycogenolysis, so this is the glycogen, break the name, glycogen lysis, that is a glycogenolysis. Gluconeogenesis, yes, neo means new, neo means new, new glucose formation is the gluconeogenesis. So answer is the D. Agree? Very good, Ankush, Mahesh, you all are right. So thank you very much. This was our session. Okay, again, if any kind of the doubt, any kind of the your query, you can ask here. Stay tuned with Telegram, YouTube channel. We are very close, yes, 90,000 subscribers. So you will see the very many free videos at the Telegram. You will get the quiz every day. Okay, fine. Okay, so thank you very much. Again, we will meet together. ऑल द बेस्ट, गॉड ब्लेस यू ऑल। एट द एंड सिर्फ हंगामा खड़ा करना मेरा मकसद नहीं, कोशिश है कि सूरत बदलनी चाहिए, मेरे सीने में नहीं तो तेरे सीने में ही सही, कहीं भी हो आग लेकिन ये आग जलनी चाहिए। रिमेंबर माय डियर फ्रेंड्स, इफ यू वांट टू गेट एक्स्ट्रा यू हैव टू डू एक्स्ट्रा। ओके, ओके, ऑल द बेस्ट, गॉड ब्लेस यू ऑल।